with. First Minister, we've literally received a notification from Albert Heaney within minutes of the guidance that may be changing for care homes and visits to care homes. I've received constituents' concerns regarding the ability to visit relatives in care homes who may be suffering with dementia. And there are some excellent examples. Sunamore in Aberavon actually uses video contacting, video FaceTime. They go around to every resident to ensure every member of their family has a chance to see them. That's not possible in all care homes. Now, the guidance that's just come out give us indication that they seek comments from the public, and guidance will be published in the coming weeks. But your review is scheduled for next week. Can you give us indication as to whether there will be opportunities for care homes which are COVID-free to actually allow visits from families, particularly to members who have dementia, who see a friendly family face as crucial to their mental well-being? As part of your thinking and those guidance.
So I thank David Rees for that, and just to say again, I hugely appreciate the human cost that there is for families and for residents in not being able to see one another at times in their lives where that human contact means so much to them. But Mr. Rees referred to care homes in Wales where there is no COVID in circulation, and 3/4 of all the care homes in Wales have not reported a single confirmed case. But there are only two ways really in which coronavirus could get into a home where there is no coronavirus at the moment. One is it is brought in by a member of staff, and the second it is brought in by a visitor. So the rules that we have had in place are absolutely there to protect care home residents from the devastating effect which coronavirus can have in a home which has elderly people with underlying health conditions living in close proximity to one another. And week after week, Clywyd, in these sessions, we have had to stare at those very, very sobering figures of the number of people who have died in care homes in Wales. So Mr. Heaney's letter, which went out on the 5th of June, does advise care homes about how they can do more to allow visits from family and friends to care home residents in circumstances which minimises that risk. And care homes are able to do that under the current regulations. It doesn't require a change in regulations to be able to do the additional things that Albert Heaney is advising. And as David Rees said, there are many, many care homes in Wales who are already doing hugely imaginative things to try and bridge the gap between what was possible before and what has been possible during the pandemic. We have a group working on that further guidance. It meets again tomorrow. We want to be able to do more to allow families to have contact with people in care homes, but we can only judge it against the real risk, the risk we have seen from the number of deaths that have taken place, of what the virus does if it does get into a care home, where up until now, all those efforts have succeeded in keeping it at bay.